Welcome back. This is Pharma Careers, clear role breakdowns, practical skills, and step-by-step career roadmaps.
So you thinking about a career in pharma? Ever pictured yourself in a lab coat making a real difference? Well, today we're pulling back the curtain on pharmaceutical quality control. We're going to get real about what it takes to succeed and, just as important, where this path can actually take you. Let's get into it.
Here's the plan. First up, we're going to hit the big one: expectation versus reality. Then we'll take a peek inside the QC lab to see what a day really looks like. After that, we'll tackle the moment of truth. What happens when results go wrong? We'll break down the true skills you need to have, and finally, we'll map out your career path from there. All right, first things first, let's talk about the gap between what people think a pharma lab is like and what it actually is. I call this the shock of discipline, and honestly, it's the first big hurdle for anyone starting out in this field.
A lot of us picture lab work as this creative, experimental space where we're making new discoveries. But in a pharmaceutical QC lab, well, that's not the game we're playing. You're not there to explore your curiosity. You're there to produce regulated, repeatable, and absolutely bulletproof data. Every test, every measurement has to be so solid that it can stand up to an audit, because patient safety is riding on it.
Okay, so with that reality check in mind, what does it actually feel like to work in a QC lab? Let's step inside and see what a typical day holds for an analyst. The work can be incredibly varied. One day you could be running instrumental analysis using some really cool machines like an HPLC or a gas chromatograph to see exactly what's in a sample. The next you might be doing dissolution testing, literally seeing how fast a pill dissolves. Or maybe you're testing raw materials before they even get near the production line. And then there's the whole microbiology side of things, hunting for tiny contaminants or making sure a product is completely sterile.
But here's the thing, no matter what kind of test you're running, the workflow is almost always the same, and it is incredibly structured. You get a sample, you prep it, you check your gear, and then you run the test exactly. And I mean exactly as it's written in the Standard Operating Procedure, or SOP. Every single move you make is controlled and has to be documented.
And this brings us to one of the most important truths of quality control. You could be an absolute wizard with the equipment, but if your documentation is a mess, you're a massive liability. Your lab notebook, your data files, they have to be pristine. Because if an auditor can't follow your work, then as far as they're concerned, it didn't happen.
Now, this is where it gets really interesting. I mean, anybody can handle things when they're going right. But the true test of a QC professional, it's all about how you react when the numbers on the screen are not what you expected.
Sooner or later, you're going to run into two kinds of unexpected results. The first is out of specification, or OSS. That's a clear failure. The result is outside the acceptable limits. The second one is a little more sneaky, out of trend, or OOT. Now, this result might technically be a pass, but when you look at it compared to all the past results, it's a weird outlier. It's a warning sign that maybe, just maybe, something is starting to drift.
So put yourself in that situation. You've just run your test. The result flashes red on the monitor. It's OUS. You feel that pit in your stomach, the pressure's on. What is your very next move?
And this slide just nails the difference between a rookie and a professional. The rookie panics. Their first instinct is to try and fix the result. Maybe retest it again and again until a good number pops up. That is the worst thing you can possibly do. It's a huge red flag for regulators. The pro, they don't try to fix the result. They investigate the cause. Was it something I did wrong, or is there a real problem with this product?
This right here is the mantra you have to live by in QC. The second you see something weird, you stop. You don't touch anything, then you document everything you saw, everything that happened. And only then do you start to investigate, following your lab's procedure to the letter. There are no shortcuts, period.
Okay, so if you're going to handle that kind of pressure the right way, you need a very specific set of skills. Let's talk about what actually matters if you want to build a real career in quality control.
Look, it's not about being some kind of creative genius. It's about discipline. Can you follow that SOP without any deviation? Do you have the basics of the instruments down? Are your calculations perfect? Because one tiny math error can bring everything crashing down. And, like we've been saying, you need that rock-solid documentation habit and, most importantly, an investigation mindset, not a fix-it mindset.
Once you master those skills, QC stops being just the job. It becomes the launchpad for a really powerful career. So let's look at what that path forward can look like.
You'll probably start out as a QC analyst, really learning the fundamentals.
But from there, once you've proven yourself, you can move up to senior analyst, where you're actually reviewing other people's work, which is a huge responsibility. After that, maybe you become a lab supervisor, or you specialize in something like method validation, where you're actually designing the tests, or even move into bigger quality systems roles. That discipline you learn in the lab opens so many doors down the line.
So if you're ever in an interview for a QC job, this phrase right here is pure gold. This tells the interviewer that you get it. You understand what this job is really about. It's not about bragging about your technical skills. It's about showing you have a professional mindset. This commitment to process, to documentation, to integrity, that is the absolute heart of quality control. And when you think about it, that's a skill that's valuable pretty much everywhere, isn't it?
If this helped, like and subscribe. Watch the next video in Pharma Careers for the next role breakdown.